J. Fox Foundation has a nationwide program called Partners in Parkinson's, which aims to help the Parkinson's community find the information they need to best tackle their diagnosis. So joining us today to talk more about Parkinson's disease and available resources for this community are movement disorder specialists Dr. Irene Richard and David Rhodes, who was diagnosed with Parkinson's disease in 2006. Welcome.
Thank you. Nice to be here.
Good. So, Dr. Richard, let's start with you. What exactly is Parkinson's disease and what are the symptoms?
So, Parkinson's disease is a progressive brain disorder that is common, affects about 1 million people in the United States, and the symptoms are varied, but slowness, difficulty initiating movement, stiffness, sometimes tremor. Those are the classic symptoms that we think of. As the disease progresses, patients can also have difficulties with balance, but in addition, it can cause symptoms that are not just involving movement. So, for example, depression, anxiety, decreased sense of smell. Those are all other potential symptoms of the disease, and it varies a lot among people.
Okay, so David, how has Parkinson's affected you and your family and friends and basically just your life?
Well, the thing is, when you have something like that, the first thing people say, and my kids were concerned about, Dad, are you going to live a good life? Mm-hmm. And I said, yes, I am. And one of the things I've really gotten heavy into, which has helped very much in making me stronger with the Parkinson's, is exercise. It's a great way to fine-tune your muscular bit so you avoid falls and things like that. It's been very helpful. But as far as my caregivers, my wife's the best caregiver I ever had. And she watches out for me, takes care of me, and my children, they're watching out, and the grandkids are always calling me and asking me how they're doing. So it can be either family or outside family. I might say that your doctor is a very important part of your caregiving too, and that doctor must have and should have specialty not only in neurology as a specialist, but also the movement disorders should be a part of their lives too.
Absolutely, and that community is so important. So it's really amazing that Michael J. Fox has been able to continue his acting career. What do you think is helping him to be able to do that with his treatment?
Well, I think that in general, first of all, I think I made the point that everybody's symptoms are different, and also the rate of progression is different among a lot of people. So one thing that it's hard to generalize. I think that what I would say in general is that people certainly having a positive attitude, as I think Dave is a great example of, and feeling a sense, I think, of empowerment and feeling as though you really are a partner with everybody else in the disease. I think that probably is one of the greatest things that you can do, in addition to having the resources like, for example, a movement disorder specialist who knows exactly what is available to treat you. So, I think that those are all factors.
Right, absolutely.
I think that we can all be thankful for that.
Good. So tell us real quickly about Partners in Parkinson's. What does this program offer that is not currently available?
So, it's an initiative that is, again, meant to close the gap in knowledge. And so what it offers is it provides patients and their caregivers with information about available resources for them. And that includes, there's a link where you can go on and you can put in your zip code and find out if there's a movement disorder specialist in your area and the names of those individuals. So, that's one thing that I think that there isn't necessarily, that I know of, another way to do that quite so easily.
Thank you both so much for joining us. For more information, you can visit partnersinparkinsons.org.